Rasheedrick, one of the PRN providers. I just want to give a little insight on endometriosis and an overlap. So when we're thinking about both conditions are chronic conditions. They are systemic inflammatory process diseases, which shows through research there is a genetic correlation between endometriosis and an autoimmune type disease such as Hashimoto, psoriasis, multiple sclerosis, lupus, just to name a few. When the research shows that there is a immunopathogenic mechanism between the immune condition and the endometriosis, which is causing such thing as the chronic inflammation and the immune cells dysregulation. So just a little insight on that, we can say, well, what is the importance of the two and the overlap? Well, a person that is experiencing pelvic pain may already have been diagnosed with a autoimmune disease diagnosis, and it shows that further investigation could warrant for the workup, possibly for endometriosis evaluation, especially if the person is experiencing any pelvic floor dysfunction, any pelvic pain. There's also the case where a person who has already, such as female gender, been diagnosed with endometriosis and may be exhibiting pelvic floor dysfunctional type problems, pelvic pain, and also exhibiting other type of autoimmune type diseases, warrant further investigation for autoimmune disease evaluation due to there is an increased risk of having an autoimmune disease if already have a diagnosis or even an unknown diagnosis of endometriosis. It does not mean every patient will have both, but there is a high risk of both having a co-occurrence together based on the research and the chronic inflammation, systemic inflammation that's related with both disease process. So it warrants, further investigation on both sides if symptoms exhibit that. And then ultimately the goal is the management of both disease process. Thank you.